Welcome to the Holistic Oral Health Summit. I'm your host, Jonathan Landsman. Did you know that 80% of disease symptoms are related to problems in the mouth? As a health and fitness consultant for nearly 30 years, I believe this is one of the most overlooked problems within conventional and integrative medicine. That's why I created this summit, to help you identify, prevent, and eliminate the roots of disease. Our show today, is it wise to keep your wisdom teeth? Our guest, Dr. Blanche Grube, graduated from Queens College and received her doctorate from the University of Medicine and Dentistry of New Jersey in 1982. Dr. Grube also holds a second doctorate in integrative medicine from Capital University of Integrative Medicine in Washington, D.C. She received her training in conscious sedation at Albert Einstein Hospital, New York, and St. Joseph Hospital of New Jersey, now Rutgers School of Dental Medicine. With extensive training in homeopathy, nutrition, iridology, colon hydrotherapy, neural therapy, and acupuncture, Dr. Grube is a board-certified biological dentist from the International Academy of Biological Dentistry and Medicine, a past president of the organization, holds fellowships from the Institute of Natural Dentistry and the Dental Association of Conscious Sedation, worked with Dr. Hal Huggins for over 23 years, and is now the only educator of the Huggins-Grube protocol. Please join me in welcoming Dr. Blanche Grube. Dr. Grube, welcome.
Well, thank you very much, Jonathan. It's my pleasure to be here. It really is.
Dr. Grube, help us to understand how the body deals with specific tissue types, and why should we care about this to begin with?
Oh, I'd be delighted. You know, anybody who's ever had an ingrown hair understands that when something is in the wrong place at the wrong time, it creates a problem for the body. So let me explain a little bit about that. In order to do that, I do have to get a little technical and a little scientific. When we look back at the point when, we're really getting historical here, at the point when the sperm and the egg come together, they form and they make that one first cell that's going to turn into be a full human being. That cell divides, and then those two cells divide again, and then the four cells divide again, and on and on and on this goes until you have something called a blastomere, which is a ball of cells. Then, for some, obviously I believe in a lot of energetic work, and there's other reasons why I believe it's not just genetics, and other reasons why this ball of cells turns into a full human being. So something happens, let me just say that something happens, and part of that ball begins to pinch in. And when it does, the cells begin to differentiate. That's a fancy way of saying they begin to have differences amongst themselves. The cells that are on the outside of this ball become ectodermal cells, meaning that those are the cells that are designed in the full-grown human being to become outside cells. Ecto means outside. So those are the cells that become hair, skin, nails, and actually the crown portion of the tooth. Ectodermal cells, everything that is on the outside. The cells that roll in and continue to proliferate inside this ball become mesodermal cells. That means inside, in the meso, in the middle. So those cells are the ones that become our organs, and one of the things that it becomes is our bone marrow, the inside of our bones, and it also becomes the root of the tooth. The root of a tooth is mesodermal in nature. So it's a very interesting combination because in a tooth you have two different natures, two different types of cells. You've got ectodermal on the top, and the root of the tooth, which is actually inside the bone marrow, is mesodermal. So I don't even know that there's any place else in the body where you have that combination of two different kinds of cells because they're in two different parts of the body. The crown portion of the tooth was always designed to be outside the body. The mouth is considered outside the body. In that ball of cells that I was talking about just a few minutes ago, when that first group of cells pinch in and they go from one end of the ball completely to the other end of the ball, and actually on one of my videos you can actually see me sticking my finger through a balloon to try to give people a visual of what that's like. When that happens, the one end of that pinch becomes the mouth, and the other end of that pinch becomes the anus. So technically, when you put your finger inside of a balloon and push through a full-blown balloon, your finger really is not inside the balloon. It's still on the outside of the balloon. I'm hoping that our listeners can visualize what I'm talking about. So your mouth, your esophagus, the lining of your stomach, the lining of your small intestines, large intestines, all the way out to your anus is actually outside the body. So if you swallow a marble when you're a child and it's rolling through you, technically the marble may be in your stomach and it may be in your intestines, but the marble is not inside your body. And then, of course, hopefully it comes out the other end. Teeth are different, though. Teeth, part of the tooth is outside the body. It's in the mouth, the crown portion. The root is inside the body, inside the bone marrow. That is considered inside the body. So it's a very interesting thing. If a person has a tooth that for some reason did not develop the way it's supposed to develop, or it developed but then didn't get that signal that said, okay, now it's time for you to erupt and for you to come outside, put your crown portion of your tooth outside of the mouth, for some reason that doesn't happen. It can, and there's so many environmental factors that can create havoc in the body. You know, the mother could have had a stressful day. There could have been radiation involvement. There could have been alcohol involvement, cigarette involvement, any one of those, the myriads of toxins that we come into contact with every day that kept that signal from happening the way it was supposed to happen. And so the tooth then becomes impacted. It's just sitting there. Now, not all impacted teeth are in a position where they couldn't possibly come out even if they wanted to. We call those laterally impacted. In other words, the tooth is lying down sideways. It's actually facing in the wrong direction. And if it was to start moving and start trying to erupt, it would literally crash into the second molar of the tooth in front of it. Not all teeth are like that. Many of the impacted wisdom teeth are literally in the right position. Their crown is facing up, their roots are facing down, but they're just sitting there. Something is preventing them from coming out. And so what happens with year after year after year, you've got ectodermal tissue, which is the crown portion of the tooth. You've got ectodermal tissue in a mesodermal space. That is something that is totally not tolerated by the body. So getting back to my original example, somebody's got an ingrown hair, and those of our listeners who have had an ingrown hair, they know exactly what I'm talking about. It hurts like the dickens. And usually not only does it hurt, but then the body says, okay, we've got a problem. We've got ectodermal tissue in a mesodermal space. We have got to get rid of it. So the first thing the body does is send white blood cells to the rescue to try to attack this piece of hair. And if it can't dissolve the hair, the next thing the body does is puts lots of fluid around this hair. And so then before you know it, you've got what looks like a cyst or a huge pimple. And now it's turned red, and it's hot, and it's painful, and it's a real problem until you build up the courage and you just say, you know what? Somebody give me a straight pin. I'm going to prick this thing myself. And somebody will pop it, and out comes the fluid, and usually this long curly hair comes out also. See, that's the body's solution. Well, the exact same thing happens in the mouth. If you have an impacted tooth, again, ectodermal tissue in a mesodermal space, the body becomes aware of that being a problem. And so it sends white blood cells first to try to dissolve the problem. Then if it can't do that, then it's going to send fluid to the area, and that fluid is going to build up around this impacted tooth. And before you know it, you've got something called a cyst in your jawbone. Now, does this happen to everybody who has an impacted tooth? No. I almost wish it did, because then they would take care of the problem sooner rather than later. There are a lot of people out there who their immune system just doesn't function as well as it should. And so the tooth sits in the jawbone for 10, 20, 30 years, and then it becomes cystic. And the problem with that, of course, is that the patient is a lot older and can tolerate the surgery a lot less. Now, when I was in dental school, I was told way back then that if a tooth becomes cystic, it must be extracted right away. And of course, we were told to extract wisdom teeth because they could become cystic. Well, it just didn't resonate with me. And I thought, you know what? If it ain't broke, don't fix it. So when I first started practicing, I would probably say for the first 20 years of my practice, I would tell people, if it ain't broke, don't fix it. If your impacted teeth are not bothering you, leave it alone, because the surgery itself is pretty traumatic, and you're going to be looking like a chipmunk for the weekend, and your jaw's going to be sore, and you're not going to want to open your jaw wide, and it's going to mess up your weekend. That was really my thinking. Boy, was I wrong. I couldn't have been any wronger. And the very first patient of mine who had an impacted wisdom tooth that became cystic, lo and behold, was my father. God has a funny way of bringing things to our attention. My father calls me up in the middle of the winter and says, I've got a bump in my mouth. And I said, really, Dad? He lives down in Florida. I said, Dad, would you do me a favor, go to the local dentist, get an x-ray, and send it to me. He sends me the x-ray. I take a look at it, and I said, oh, boy, your wisdom tooth has become cystic. Your body is trying to get rid of it. I said, Dad, you've got to come and get that tooth taken out right away. Of course, my father said, I'm not coming to Scranton in the middle of the winter. Are you crazy? I'll wait until June when I come up to see you, and I'll get it taken out then. That was 6 months later. By the time my father came up to Scranton to have this cystic impacted wisdom tooth removed, the hole was the size of, I would say, a plum, about the size of a plum, which meant that he had lost about 50% of his upper maxillary bone. And I was scared to death. And I thought, oh boy, I should have told him to get that wisdom tooth taken out a long time ago. Of course, then I continued my studies with Dr. Huggins, and he happened to mention one day that ectodermal tissue never belongs in mesodermal space. And it clicked in my head, and I said, you know what? He's absolutely right. And so I went back to my embryology textbooks, and I continued to study. And I said, yeah, you know what? This is basic embryology 101. If something is in the wrong spot in the body is going to spend a lot of time, a lot of energy, and waste, unfortunately, a lot of precious white blood cells trying to get rid of what does not belong there. So that's my message right now. I really think that impacted teeth should be removed. Now, if somebody has a perfectly good wisdom tooth that has erupted at the right time, which is usually between the ages of 18 to 23, if it's erupted during that time and the tooth is in the mouth, wonderful. Congratulations. Leave it alone. But if the tooth is impacted, then that's going to be an added stress to your immune system. And that's what our practice is all about, removing stresses to the immune system so that your body can deal with the really important things that are coming down the pike. We live in a very stressful world. We live in a world that has all kinds of environmental toxins. The last thing you want to do is add one more. This is the same reason why we encourage people not to smoke. We encourage people not to be heavy alcohol consumers. We encourage people certainly not to do illicit drugs, because you want to give your immune system a break. Cut it a break. Let it deal with the things that it has to deal with. Don't add more burdens to it. And so that's why now I have done a 180-degree turn, and I tell all of my patients that have impacted wisdom teeth to get them out. Give your immune system a break. Let it do things that are much more important than having to deal with an impacted tooth, which is never going to erupt anyway and is never going to be able to serve you.
Dr. Grube, I can only imagine what you're about to say, and I just pray that people are listening very carefully to this, because as I said originally about this event, some of the information throughout this event, there are bits and pieces here that could literally be life-saving. Dr. Grube, can impacted wisdom teeth actually trigger autoimmune diseases?
Dr. Huggins used to say that all the time. I can't say specifically that I've actually seen it, but I can imagine understanding the histology and the embryology and how the body functions. I can imagine that happening for sure.
So what should we know before, and this is crucial information, before we allow any dentist to take care of this, before we allow that wisdom tooth to be removed, what do we have to know?
Well, you have to know and you have to understand that there is such a thing called a cavitation or a cavitational cyst. That's an area in the bone marrow where usually it's where a tooth was taken out, but the bone marrow never really fully healed the way it was supposed to heal. Now, I'm going to stick myself out on a limb right now and tell you that I truly believe, with all my heart, I truly believe that most of the cavitations form because dentists traditionally use Novocaine with epinephrine. Now, I'm saying Novocaine for our listeners. Of course, dentists know that there's all different kinds of Novocaine. There's carbocaine, Septocaine, mepivacaine. We've got a whole bunch of different ones. But the layperson understands it as Novocaine, the numbing agent. Well, when a dentist uses Novocaine with epinephrine is a very natural chemical that the body produces. It's produced in the adrenal glands. It's your flight or fight reaction. Epinephrine is what's released when you've just seen a lion and you've got to run up a tree. And so it causes constriction of your blood vessels. It causes your heart to beat fast. And it does all these wonderful things that you need to have happen so that you can get up that tree. But that doesn't mean that you want epinephrine when a dentist is just about going to do a filling on you. When the dentist gives by the way, the epinephrine is produced synthetically and put in the Novocaine ampules, a little thing that the dentist uses to give you Novocaine. When you receive Novocaine from a dentist and it's got epinephrine in it, many of our patients have told us that they do feel their heart beating faster. They're very much aware of the changes taking place in their body. And so it is true that the epinephrine causes all of the blood vessels to contract. Well, that's a good thing for the dentist because the blood vessels contract, the Novocaine stays in the spot that it's supposed to stay in, and the patient is numb for anywhere from an hour to 2 hours, and they can go ahead and proceed to take out 4 impacted wisdom teeth without having to stop and give the patient more Novocaine. That's a good thing for the dentist, maybe not such a good thing for the patient, because when those blood vessels contract, the smallest of the blood vessels, which are the capillaries, they close completely. Now, when those small capillaries close, well, their job is to take red blood cells to every cell, and that red blood cell is carrying oxygen. So if the smallest of the capillaries have closed completely, well, then those cells that are waiting for oxygen are not going to get it. So I once asked Dr. Jerry Boku, who is probably the leading world pathologist and bone pathologist expert. I once went up to him after a lecture and I asked him, how long can a bone cell go without oxygen? And his answer surprised me. He kind of scratched his head a little bit and he said, well, I'm being generous. I would say about 34 seconds. That's not a long time. So if you have capillaries that are completely closed for 34 seconds, then those cells are not getting oxygen and those cells are dying. And within a very short period of time, you have a lot of dead bone cells. So what happens? The dentist takes out 4 wisdom teeth, puts in some cotton, sends the patient on their merry way, and expects all of that bone to heal. Well, the bone is only going to heal in areas where the bone is alive. In areas where the bone is dead, it is not going to heal. So I'm really of the very strong belief that most cavitations are caused by the epinephrine given by dentists. And my phone is going to be ringing off the hook probably from every dentist in the country, and everybody's going to be jumping down my neck for making such a bold statement. But I really do believe that it's true. Why do we have so many people walking around with 4 cavitations? They had 4 wisdom teeth taken out. They're walking around with 4 cavitations. And I know you've had other speakers talk about cavitation, so I'm not going to get into a lot of the details about that, but it becomes a problem for a good percentage of the population. Now, we're on the cutting edge of this kind of science, so I really can't tell you exactly what is the percentage of people that have 4 cavitations and are sick from it and actually have symptoms that they can trace back to the time that they had their wisdom teeth taken out. We don't have those kind of statistics right now because conventional dentistry as a whole denies even the existence of cavitations. So if they're denying the existence of cavitations, how can we do those kind of studies in universities and have peer-reviewed studies and really get some good information from these studies. It doesn't exist.
Just to be clear, Dr. Gruby, you can get Novocaine for the layperson without that substance in it. And the idea is you can be numb but not close down the vessels. Is that fair to say?
Absolutely. In my office, we use Carbocaine 99% of the time. Carbocaine with no epinephrine. There's also another brand called Synonest Plain, no epinephrine. It's not absolutely necessary.
Okay, let's jump right into it because this is also equally very important to pay attention to. I ask you, Dr. Gruby, what is the best way to remove a wisdom tooth?
Carefully, very, very carefully. No, not be facetious. The tooth has to be removed carefully, but it should be removed without epinephrine. And after the wisdom tooth is taken out, there's a sac around this tooth. Every tooth has a sac. I guess you would say it's analogous to the sac around a baby before the baby's born. Well, when the baby is born, everybody's very happy and they're all looking at the baby, but the doctor's paying attention to the fact that the rest of the afterbirth has to come out also. Well, that's true of a wisdom tooth also. When the wisdom tooth is taken out, it's important for the dentist to go back in there and remove the sac around the tooth and make sure that all of it is removed so that the patient doesn't form a cavitation later on. But the advice I give people who are having wisdom teeth taken out, just ask the dentist not to use epinephrine. And if we can get the dentist to make sure all of the sac was removed around the tooth, all of the ligament that held the tooth to the bone, make sure it is all removed, then more likely than not, they're going to heal up very nicely.
And just quickly, Dr. Gruby, not that I'm a dentist or an expert in this, but I'm just sort of visualizing that if a dentist grabs a wisdom tooth and sort of pries it against another tooth, I mean, can you talk about some of the concerns about the technique used in actually, getting that tooth loose and then yanking it out?
Well, most dentists are very well trained. We're incredibly meticulous people. So I really don't think that's a problem. I mean, occasionally, very, very rarely, and I do see it, but it's very rare. Occasionally, I will see a second molar damaged because the oral surgeon had a difficult time getting the wisdom tooth out. But that's, for the most part, you don't see that. For the most part, the dentists are very, very careful.
Okay, so now that we've gotten to the point of understanding something so important before getting a tooth extracted and, how what the best ways are to remove it, what are your concerns related to these old extraction sites of wisdom teeth, which, let's face it, it's literally millions of them out there with people listening to this program, Dr. Gruby.
That's true. Literally millions of sockets that have been taken out. The wisdom tooth was removed 20, 30, 40 years ago. And if the bone marrow never healed properly, then it becomes a cesspool. It becomes a place for the bacteria that were originally in there to reproduce, to do the same thing we do, eat, metabolize the food, and then, we call them toxins, but it's literally the piss and poop of bacteria. When those piss and poop of bacteria, the toxins that they produce after they've eaten, when that level gets high enough, then those toxins begin to seep out of the cavitations. Then is when the patient begins to get symptoms, because then the body is alerted to the fact that there's a problem in that area. And so then their immune system is now struggling to try to take care of this infection. It's very difficult for the body to do because there's no circulation inside of a cavitation. So a white blood cell can't get in there, and they want to get into, they'll get close to the area, but they can't get inside. There is no circulation inside a cavitation. So when we open these cavitations up, it literally is a cesspool. There's no bone marrow. Sometimes there's black oil in there because the nerves at the bottom have disintegrated. Sometimes there's pus in there. Sometimes it's just empty. It's an empty hole because I can't smell or see the gas that is coming out of it.
So, another thing that I want to ask you, Dr. Gruby, is not necessarily, a lot of people would have their wisdom teeth pulled out and they don't really feel any symptoms. But like you were saying about an impacted wisdom tooth, hey, it may not be presenting any symptoms now, but as you get older, there's problems. This stuff that you're describing doesn't necessarily represent physical pain for someone. Is that fair to say?
You're absolutely correct, Jonathan. There are a lot of people that don't make the connection between symptoms that they may be having today and the fact that they had a wisdom tooth taken out 30 years ago that is now creating a problem for the body. And also the truth is that it doesn't happen to everybody. There's some people that heal very nicely after having wisdom teeth taken out, even with epinephrine. The rule doesn't fit everybody. Now, there are people who smoke cigarettes, drink alcohol, and they still live to be 80. I don't know how they do that, but they do.
Well, this is also, again, as a side note, but I think it's important to bring up, Dr. Gruby, just in general, this is what I think is so tricky about taking care of one's health, right? I mean, conventionally speaking, if somebody has been living the life the way they've been living and all of a sudden they get diagnosed with cancer, I mean, conventionally speaking, they're probably going to be given an answer like, well, we don't know what really caused your problem. And then on top of that, they're never taught some of the things that the crucial information that you discussed with us today about how all of these influences stress out our immune system. And over time, this is what wears us out. And then, okay, it's not about feeling guilty about what we've gone through in the past, but let's get busy at, getting more nutrients in. Let's get busy with removing things that are aggravating our immune system. I mean, this whole thing I'm describing is not an attitude of conventionally trained physicians, but it would be more from your conventional training and now how you've, broadened your horizons. It would be something that a person can talk about with a physician like you. Isn't that true?
It's absolutely true, Jonathan. I couldn't have said it better. And so when somebody does get that diagnosis, the first thing they should do is look inside the mouth. See what they have. Do they have a mouth full of mercury fillings? Do they have 5, 6, 7 root canals? How many implants do they have? How many cavitations do they have? The first place you look at is the mouth. If you went to a cardiologist, the first thing the cardiologist would do is put you on a scale, see how much you weigh, do some blood tests, see what your triglyceride level is, what's your cholesterol level. Well, in biological dentistry, the first thing we do is look inside the mouth.
But I see this as being the disconnect, right? Like so many conventionally trained physicians are so trained at one specific thing. Heart trouble, take a look at the heart, right? If you have gut issues, take a look at the digestive tract, and well, we can't seem to find anything. Well, it's still just a mystery. And this more holistic point of view is saying, look, the bottom line is problems with disease in general are basically, the way I put it, too many toxins that a body is dealing with and not enough nutrition as a buffer or a way of nourishing, a healthy, happy life. And that combination is just common for everybody. And now it's a matter of looking at each individual and seeing where is it that that person may have some serious assaults or serious deficiencies, and let's go after it and try to fix those things. I mean, conventionally speaking, they don't look at things like that as a cause of disease.
That's correct. Every dentist is trained to work in the mouth. Seldom are you told that the mouth is connected to the rest of the body. So in medicine, it's so compartmentalized. We don't have, one person or one specialty that actually pulls it all together. That really, because, and I don't know that would ever happen because there just is so much information out there. But you're absolutely right. It's just way too compartmentalized. And for me, I really don't care what you call the disease. I don't care what kind of name you give it. It's all the same to me. It's overload of toxicity. Absolutely. Overload of toxicity and not enough nutrition to deal with that level of toxicity.
And I've often mentioned how, for example, there's clinics I know outside the United States that actually look at cancer patients as an example. Before they do any other kind of cancer treatment, they're taking care of problems in the mouth. The reason why I bring this up is just to highlight the importance of what you're talking about. It's not that every single time that someone has autoimmune disorders, a wisdom tooth or an impacted wisdom tooth is to blame. but the idea is to really appreciate the problems in the mouth that could be polluting the rest of the body. And I mean, if you see an infected root canal treated tooth, there's an impacted wisdom tooth and there's swelling, or there's some sort of bone decay and infections in the mouth, how could you possibly ignore that and just sort of tell someone, even holistically speaking, as an integrative physician out there, tell someone, hey, why don't you just sort of change your diet, which is nice, or why don't you take some supplements? That would be nice too. I don't have a problem with that. And just ignore the aspects of what's happening in the mouth. I'm sure you would agree.
Absolutely. Absolutely.
So, Dr. Grube, as we close out this program, I'd love for you to share some amazing stories of recovery. I mean, one in particular is a part of this event with Dr. Robert Kleinwax, who has really just raved about being thankful, I should say, so grateful that he ran into you because you literally took him in and took care of the problem right away. I'd love for you to share that story. I mean, we certainly have his permission to do it. And any of the other stories that might come to mind to really highlight this connection between issues in the mouth and how it really helped people to turn their health around, without a doubt.
Well, Dr. Robert Kleinwax is one of our favorite patients. He's a chiropractor, and my husband's a chiropractor also, so they all get together. And those guys, they're always talking together. And usually once that happens, I leave the room because I know it's going to go on forever. And they love to tell patient stories also. But he was definitely one of our success stories, but he was just one of many. We had a patient, just came to my mind now, we had a patient who walked in with a walker. She had MS, and after her dentistry, what we call the full mouth dental revision, done the right way, after her revision, she no longer needs the walker, and it's been 5 years for her now. We call her up every once in a while, see how she's doing. She says she's just doing fantastic. I mean, we have just so many stories. Most of our patients who have phenomenal success are the ones who are suffering from chronic fatigue. They wake up tired, they go to bed tired. As a matter of fact, the first patient I removed amalgam on was the woman who gave me my first article to read about mercury toxicity. She could only do one thing a day. She could either go food shopping or do one load of laundry, but she could never do two things in one day. And I did her complete dental revision, and she was saying that a year after that, she was up at the top of Elk Mountain getting ready to go downhill skiing, and it just occurred to her that she didn't have chronic fatigue anymore, that she certainly could not have gone skiing a year prior to that. My biggest success story is my own story. I had my own fillings removed and 5 root canal teeth removed. My brain fog disappeared overnight. And my chronic metablastic leukemia, I had 1% metablastic cells. They disappeared in 3 weeks. So I always tell people I'm my best success story. And we hear that all of the time. We really do. People who are saying their clarity of thought is so much better. They have more energy. A lot of the symptoms that they had are completely gone. Does it happen to everybody? No. We don't have 100% success, but it's very high.
Dr. Grube, as we close out the program, I hope this doesn't seem like such an aside for people listening, but I know you appreciate this, and I would love to hear from you just your overall opinion on this whole concept. And again, I'm going to say this before I mention what I'm talking about, that I know conventionally speaking, this sounds like such woo-woo science and really has nothing to do with our health. But this thing that you alluded to earlier on about how all of these issues that we talk about in the mouth, whether it's gum disease, unfriendly oral pathogens that are floating around inside and how that pollutes the rest of the body, and infected root canal treated teeth or impacted wisdom teeth that are causing problems, all of these issues have an electrical signal. And I think it's really important that it isn't such a woo-woo thing to say that all of these physical issues in the mouth do have physical electrical signals or disturbances that flow throughout the rest of the body. And this is why I feel like this is one of the most overlooked problems in conventional or integrative medicine, for that matter, is that this is so important to make sure that the mouth is healthy and functioning properly so that we can enjoy that healthy, happy life that we all want, right?
It was President Nixon that went to China with one of his cabinet members, And the cabinet member had an appendicitis attack while in China. And they actually did the appendectomy using no general anesthesia. They only used acupuncture. And that was the beginning of the opening of a relationship between the Chinese people and the American people. They started bringing over the information that they knew about acupuncture and meridian studies. And so that helped us in North America and in Europe tremendously, because then we began to see that the Chinese had already mapped out the energetic field of every organ and found out that every organ is attached to a tooth. Every meridian in the body goes through a tooth, directly or indirectly. So when you have a problem with one of your teeth, it's energetically going to affect the organ that it goes to. So, for instance, your first molars are connected to the large intestines. So that means that you have this cloud of energy traveling from the large intestine to the first molar and then back to the large intestine, and it kind of goes back and forth all day long. Well, if you have a dead tooth, which is a root canal, or a root canal, I should say, if you have a dead tooth or a root canal on one of your first molars, well, then that tooth can no longer give out the same amount of energy that it received. And if that happens, well, then energy comes up from the large intestine, goes to the first molar, but comes back deficient. There's less energy going back to the large intestine. And so after a while, the large intestine is definitely going to suffer. So we get patients who come in to see us sometimes, and they'll say, you know what, this tooth is bothering me. And I take a look at the tooth, and the tooth is a virgin tooth, meaning it's never had a cavity, never had a filling. Tooth looks perfect, but the tooth is bothering them. Well, in our office, we actually take a look at the meridian chart and see, well, what organ goes to that tooth? Because the discomfort that they're feeling could be coming from the organ, and it's totally an organ problem and not necessarily a tooth problem. And conventional dentistry has a long way to go to catch up to us before they start looking at the body as it is, all connected.
And it just seems to be such common sense, Dr. Gruby, that when we're looking at someone that has very low energy, I mean, it's so simple, so easy. When I first started studying natural medicine and natural therapies, my teachers would say that the first sign of disease is fatigue. And although it makes common sense in conventional medicine, someone's a little tired, they just sort of brush it off and get the person out of the office, and they don't even discuss how their sleep is or what kind of toxins could be, playing a heavy role on them. But my bottom line is here, my point is that this low energy that you described, right, this low electrical signals, we see this as a real physical connection with people that have the most serious health problems like cancer. They have low vibrational energy versus someone that has a high vibrational energy that tends to be healthier. Is that fair to say?
That's very fair to say. Absolutely. And if you were going to buy a horse, the first thing you would do is look at his teeth, correct? The first thing a person does if they're going to buy a horse is look inside the horse's mouth and see how healthy the horse is. It's the same with humans. If the mouth is not healthy, the body can't possibly be healthy.
So, Dr. Gruby, just as we close out, I should ask you this. The wisdom teeth, which, I'm no expert, but it's 2 on top and 2 on the bottom, right, on either sides of the mouth, right? Where are they connected to the rest of the body? How does that work?
Energetically, the wisdom teeth are connected to the heart. And it's interesting that about the time, if somebody had their wisdom teeth taken out when they were 18, 19, 20 years old, then the toxin levels inside those cavitations would probably be at the point when they're about 50, 60 years old, would be the point at which they would start to have a problem there. And that's also the point at which people start to have problems with their heart. So I think there's an interesting correlation there.
And again, just to add on and to bring clarity to this discussion, Dr. Gruby, when people say, well, I don't get it, if there was no problem earlier, why is there a problem now? I'm sure you hear that all the time. Can you just explain, why this stuff happens later on with something that seems to be okay?
Well, because the amount of toxins take time to build up inside the cavitation. It takes years for that to happen. So when you first have a wisdom tooth taken out, you're not going to notice any difference. It's not until years later when the level of toxins build up to the point where they start seeping out of the body. They start seeping out of the cavitation. That's when you notice it.
And it's, again, conventionally speaking, it seems to be a pervasive attitude about everything when people are trying to seek answers and they have sort of a gut feeling, if you will, pardon the pun, that something is wrong inside. And they'll say maybe it's the genetically engineered foods, right? Or maybe, it's a vaccine or something. Conventionally speaking, they roll their eyes and they say, well, it's so little. Or maybe it's the cell phone next to my head. Well, it's only for a minute or so. But they never appreciate what I think you're alluding to right now. You're clearly saying it, actually. This idea of it being bioaccumulative over time and wearing out the body.
Exactly. It's not one phone call with your cell phone next to your head that's going to cause a tumor. It's using your cell phone day in, day out on your head that's going to cause a tumor. That's always a possibility. And again, it's never just the cell phone. It's the cell phone and the genetically modified foods and the lack of good nutrition and the sodas and the refined cakes and all of that stuff. And it's an accumulation of a lot of things. And so when, it's very interesting. The same people that look at alternative medicine, and say, well, you know what, that's a long shot. You can't be looking at somebody's mercury levels or cavitation to cause a problem. Those same people are the ones who are going to give you a pill and say, here, this will fix everything. Really, one pill.
Dr. Grube, I want to thank you so much for your time, and I want to thank our listeners for joining us today. If you would like a copy of this program plus all the other presentations inside the Holistic Oral Health Summit, simply click the banner you see on this page. Thanks again for attending the Holistic Oral Health Summit. Talk to you soon. Take care.